compression direction, then you observe an angulation and you are not interested in what's happening inside the joint. So osteokinematic movement, using that for assessment, is mainly angulation. And angulation is specific to provoke compression pain at the site you're moving to, or stretch pain in the other side of the joint. So the further away the structures are from the axis of movement, the more stretch there will be on ligaments, skin, muscles, etc. Yeah? That's why ligaments, in general, are assessed by angulation tests. For example, medial and lateral collateral ligament, angulation, AP and adduction. There's one exception, cruciate ligaments, because they are very centrally right on the axis of movement. So if you do a slight movement, it's probably more a provocation of the central cruciate ligaments than on the capsule. So we have to do something specific. So in general, ligaments are further out than the capsule. So if you want to provoke ligaments, skin, muscles, tendons, etc., use osteokinematic movements, angulation. Yeah? If you compare that with arthrokinetic movements, and for example, you make a flexion movement in the knee or wherever else, then we are very curious about what's happening inside the joint. The displacements from contact areas from one point in relation to another one. In arthrokinematics, you could say that if you have the axis in angulation in the convex bone, and you change the position in the joint, then there has been a slight movement of concave in the same direction as the angulation, because the axis of movement is in the fixate bone. So far clear? So extension in the knee, the tibia slides forward, because it's concave. Yeah? In abduction, glenohumeral joint, the axis of movement is in the moving bone. So while the humerus is rolling up, it slides down, because the axis is in the moving bone. Let's draw that. Fixation, axis of movement, and I'm going to change the position. There. Then you see a slight movement in the opposite direction of the angulation. So roll up and slide down. Yeah? So the first thing I would like you to prepare for all the next classes is the shape of the bones. You have to know it because you want to know the direction of the slide that fits to the angulation. Also in the elbow joint, the little bones of the wrist, you have to know convex and concave. Otherwise it's impossible to